Hello, I'm Dr. Elizabeth Coyne and I'm here with Israel. And Israel's going to present his program, Living Well, which is developed specifically for patients and families living in Nigeria. He's going to go through this next module, which is about communication. Israel.
Thank you, Dr. Elizabeth. We are looking at when somebody is diagnosed with cancer, one of the challenges that individuals that live with cancer face is how to communicate their feeling to their loved one, and at the same time, the loved one also find it difficult to also communicate effectively with their loved one that has just been diagnosed with cancer. And that is why this module will be talking on how to communicate effectively, especially between the people living with cancer and also their loved one who always serve as a caregiver. So communication is not only about using words, but it also includes listening and observation. So communication is a very vital tool that will need to be adopted or used, especially when somebody is having cancer. So we need to communicate a lot. We need to pass information a lot. We need to see how we can adjust to the new situation that they just find themselves. So, and that is the reason why we look at it. So people, you must talk, the people with cancer must talk with their loved one, and at the same time, the loved one, the family member must also talk with their loved one that just been diagnosed with cancer. So what are the strategies that we use in communication? So we look at this one. Talking with your healthcare team, it is very important. So when somebody is just diagnosed with cancer, there is need also, and very important, to give feedback to your doctor, the nurses, and all the health professionals that are taking care of you. And that is the only way you can know what is working for you. You should be able to communicate effectively and tell them what you are passing through, how you are feeling in your spirit, in your soul, in your body, how the thing has really affected you. And by doing so, they'll be able to know how to assist you. And not just communicating with the doctor or the medical team alone. You need to also talk with the special people in your life. Who are those people? Those are the people that are related with you, your friends, your family member, your children, your loved one. You need to communicate with them. And at the same time, the loved one must also come around to also communicate effectively by ensuring that you let them know, oh, you are not alone. What you are passing through, we share your feeling. So there is need for adequate communication. Your loved one also may also need to adjust to that area by ensuring that they communicate effectively. So they need to come to terms with their own feeling also, especially the family member. So the feeling, they need to express what they are facing, because it's not just the people living with cancer that are facing challenges, especially when the cancer is diagnosed. Their family member also, they are facing equal amount of problem that the people living with cancer are also facing, because emotionally they are also down, spiritually they are down, socially they are isolated. So there is need for this rapport between this group of people. And also there is need for family meeting. There is need to come around, because people living with cancer need social support, spiritual support, financial support. So those are the things that can even aggravate the feeling and also the disease called cancer in people. So we need to move around and also have family meeting. Family meeting are necessary to have cancer care, and this one is very important. They become even more important as cancer progresses. So we need to call people around far and near and let them discuss. And what are the things that we need to discuss in family meeting? We discuss about how to take care of the loved one who has just been diagnosed having cancer. And also, we need to also have meeting with the healthcare team, explaining the overall goals for care. At the same time, let the family state their wishes for care. What can they do? What will they contribute to assist, to ensure that the quality of life of people with cancer is also enhanced, and also giving everyone as open forum in which to express their feeling. So because by expressing their feeling, they will not bottle up thing, and they will be able to have improved quality of life. And having said that, we also look at the other things that need to be done. The communication between these people are very, very vital. We cannot just emphasize on communication. And by doing so, there is going to be adequate understanding between people living with cancer and at the same time, the family caregiver. Thank you.